Module 6, Medication Management. The purpose of this module is to teach trainees the ALF's responsibility for managing residents' medication and various methods of service delivery. Objectives. Upon completion of this module, the trainee will be able to demonstrate an understanding of the scope of a facility's responsibilities regarding medications, demonstrate knowledge of medication administration responsibilities, identify staff and other persons that are qualified in various medication practices, demonstrate the activities in providing assistance with self-administration of medication, and recognize residents experiencing problems with self-administration of medications. Demonstrate knowledge of the training requirements for persons providing assistance with self-administered medications and how to document this training. Demonstrate knowledge of medication records and record keeping, storage, and disposable requirements. Demonstrate knowledge of the correct medication labeling and medication orders. Demonstrate knowledge of rules regarding over-the-counter and simple prescription medications. Demonstrate knowledge which applying to the use of medications as chemical restraints. Demonstrate knowledge with the standards applying to the use of medications as chemical restraints. Demonstrate knowledge of the conditions warranting the services of a licensed pharmacist and nursing consultant and documentation standards. Demonstrate knowledge of methods to correct deficiencies in medication practices. Medication management. The scope of a facility's responsibilities regarding medications. Residents who are capable of self-administering their own medications and performing other tasks without assistance shall be encouraged and allowed to do so. However, an unlicensed person may, consistent with a dispensed prescription label or the package directions of an over-the-counter medication, assist a resident whose condition is medically stable with the self-administration of routine, regularly scheduled medications that are intended to be self-administered. An unlicensed person may also provide assistance with other tasks specified in assistance with self-administration of medication, or such other tasks by an unlicensed person may occur only upon a documented request by, and then written informed consent of a resident or the resident surrogate, guardian, or attorney in fact. Self-administered medications include both legend and over-the-counter oral dosage forms, topical dosage forms, transdermal patches, and topical ophthalmic, optic, and nasal dosage forms including solutions, suspensions, spray, and inhalers. Assistance with other tasks includes assisting with the use of a glucometer to perform blood glucose level checks. Assisting with putting on and taking off anti-embolism stockings. Assisting with applying and removing an oxygen cannula, but not with titrating the prescribed oxygen setting. Assisting with the use of a continuous positive airway pressure device, but not with titrating the prescribed setting of the device. Assisting with measuring vital signs. Assisting with colostomy bags. Licensed facilities may assist with the self-administration or administration of medications to residents in a facility. A resident may not be compelled to take medications but may be counseled in accordance with this rule. Residents who are capable of self-administering their own medication without assistance must be encouraged and allowed to do so. If facility staff observes health changes that could reasonably be attributed to the improper self-administration of medication, staff must consult with the resident concerning any problems the resident may be experiencing in self-administering the medications. The consultation should describe the services offered by the facility that aid the resident with medication administration through the use of pill organizers, through providing assistance with self-administration of medications, or through administering medications. The facility must contact the resident's healthcare provider when observable health changes occur that may be attributed to the resident's medications. The facility must document such contacts in the resident's records. Pill organizers. Only a resident who self-administers medication may maintain a pill organizer. Unlicensed staff may not provide assistance with the contents of pill organizers. A nurse may manage a pill organizer to be used only by residents who self-administer medications. The nurse is responsible for instructing the resident in the proper use of the pill organizer. The nurse must manage the pill organizer in the following manner.
Obtain the labeled medication container from the storage area or the resident. Transfer the medication from the original container into a pill organizer, labeled with the resident's name according to the day and time increments as prescribed. Return the medication container to the storage area or resident and document the date and time the pill organizer was filled in the resident's record. If there is a determination that the resident is not taking medication as prescribed after the medicinal benefits are explained, it must be noted in the resident's record and the facility must consult with the resident concerning providing assistance with self-administration of the administration of medications, if such services are offered by the facility. The facility must contact the resident's healthcare provider regarding questions, concerns, or observations relating to the resident's medications. Such communication must be documented in the resident's record. Assistance with self-administration of medication includes taking the medication in its previously dispensed, properly labeled container from where it is stored and bringing it to the resident. For purposes of this paragraph, an insulin syringe that is pre-filled with the proper dosage by a pharmacist and an insulin pen that is pre-filled by the manufacturer are considered medications in previously dispensed, properly labeled containers. In the presence of the resident confirming that the medication is intended for that resident, orally advising the resident of the medication name and dosage, opening the container, removing the medication from the container, and closing the container. The resident may sign a written waiver to opt out of being orally advised of the medication name and dosage. The waiver must identify all of the medications intended for the resident, including names and dosages of such medications, and must immediately be updated each time the resident's medication or dosage change. Placing an oral dosage in the resident's hand or placing the dosage in another container and helping the resident by lifting the container to his or her mouth. Applying topical medications. Returning the medication container to proper storage. Keeping a record of when a resident receives assistance with self-administration.
Assisting with the use of a nebulizer, including removing the cap of a nebulizer, opening the unit dose of a nebulizer solution, and pouring the prescribed pre-measured dose of medication into the dispensing cup of the nebulizer. Mixing, compounding, converting, or calculating medication doses, except for measuring a prescribed amount of liquid medication or breaking a scored tablet or crushing a tablet as prescribed. The preparation of syringes for injection or administration of medications by any injectable route. Administration of medications by way of tube inserted in a cavity of the body. Administration of parenteral preparations. The use of irrigations or debriding agents used in the treatment of a skin condition. Assisting with rectal, urethra, or vaginal preparations. Assisting with medications ordered by the physician or healthcare professional with prescriptive authority to be given as needed unless the order is written with specific parameters that include independent judgment on the part of the unlicensed person, and the resident questioning the medication is aware of his or her need for the medication and understands the purpose for taking the medication. Yeah. Any unlicensed person providing assistance with self-administration of medication must be 18 years of age or older, trained to assist with self-administered medication pursuant to the training requirements, and must be available to assist residents with self-administered medications. Assistance with self-administration of medication includes orally advising the resident of the name, dosage of the medication, verbally prompting a resident to take medications as prescribed. In order to facilitate assistance with self-administration, trained staff may prepare and make available such items as water, juice, cups, and spoons. Trained staff may also return unused doses to the medication container. Medication which appears to have been contaminated must not be returned to the container. Trained staff must observe the resident take the medication. Any concerns about the resident reaction to the medication or suspected noncompliance must be reported to the resident's healthcare provider and documented in the resident's records. When a resident who receives assistance with medication is away from the facility and from facility staff, the following options are available to enable the resident to take medications as prescribed. The healthcare provider may prescribe a medication schedule that coincides with the resident's presence in the facility. The medication container may be given to the resident, a friend, or a family member upon leaving the facility, with this, in fact, noted in the resident's medication records. The medication may be transferred to a pill organizer and given to the resident, a friend, or a family member upon leaving the facility, with this fact noted in the resident's medication record. Or medications may be separately prescribed and dispensed in a easier to use form, such as unit dose packaging. The terms judgment and discretion means interpreting vital signs and evaluating or assessing a resident's condition. All trained staff must adhere to the facility's infection control policy and procedures when assisting the self-administration of medication. Medication administration. For facilities that provide medication administration, a staff member licensed to administer medications must be available to administer medications in accordance with a healthcare provider's order or prescription label.
Unusual reactions to the medication or significant change in the resident's health or behavior that may be caused by the medication must be documented in the resident's record and reported immediately to the resident's healthcare provider. The contact with the healthcare provider must also be documented in the resident's record. Medication administration includes conducting any examination or other procedure necessary for the proper administration of medication that the resident cannot conduct personally and that can be performed by licensed staff. A facility that performs laboratory tests for residents, including blood glucose testing, must be in compliance with the Federal Clinical Laboratory Improvement Amendments of 1988, CLIA. A valid copy of the federal CLIA certificate must be maintained in the facility. A federal CLIA certificate is not required if residents perform the test themselves or if a third party assists residents in performing the test. The facility is not required to maintain a federal CLIA certificate if facility staff assists residents in performing clinical laboratory testing with the resident's equipment. Information about the federal CLIA certificate is available from the Laboratory and In-Home Services Unit, Agency for Healthcare Administration. Contact information provided below. Medication records. For residents who use a pill organizer managed in the facility must keep either the original labeled or a medication listing with the prescription number, the name and address of the issuing pharmacy, the healthcare provider's name, the resident's name, the date dispensed, the name and strength of the drug, and the directions for use. The facility must maintain a daily medication observation record for each resident who receives assistance with self-administration of medications or medication administration. A medication observation record must be immediately updated each time the medication is offered or administered and include 1. The name of the resident and any known allergies the residents may have. 2. The name of the resident's healthcare provider and the healthcare provider's telephone number. 3. The name, strength, and directions for use of each medication. And 4. A chart for recording each time the medication is taken, any missed dosages, refusals to take medication as prescribed, or medication errors. For medications that serve as chemical restraints, the facility must maintain a record of the prescribing physician's annual evaluation of the use of the medication. Medication storage and disposal. In order to accommodate the needs and preferences of residents and to encourage residents to remain as independent as possible, residents may keep their medications, both prescribed and over the counter, in their possessions, both on or off the facility's premises. Residents may also store the medication in their rooms or apartment if either the room is kept locked when residents are absent or the medication is stored in a secure place that is out of sight of other residents. There's about 2 or 3 test questions straight from there. Both prescription and over-the-counter medications for residents must be centrally stored if the facility administers the medication. The resident requests central storage. The facility must maintain a list of all medications being stored. The medication is determined and documented by the healthcare provider to be hazardous if kept in the personal possession of the person for whom it is prescribed. The resident fails to maintain the medication in a safe manner. The facility determines that because of physical arrangements and the conditions or habits of residents, the personal possession of medication by a resident poses a safety hazard to other residents, or the facility's rules and regulations require central storage of medication, and that policy has been provided to the resident before admission. Centrally stored medications must be kept in a locked cabinet, locked cart, or other locked storage receptacle, room, or area at all times. That is definitely a test question. Located in an area free of dampness and abnormal temperature, except that a medication requiring refrigeration must be kept refrigerated. Refrigerated medications must be secured by being kept in a locked container within the refrigerator, by keeping the refrigerator locked, or by keeping the area in which the refrigerator is located locked. It's possible 2 or 3 test questions. Accessible to staff responsible for filling pill organizers, assisting with self-administration of medication, or administering medication. Such staff must have ready access to keys or codes to the medication storage areas at all times, and kept separately from the medications of other residents and properly closed or sealed. Possible 2 or 3 test questions from this slide and the previous slide as well. Medication that has been discontinued but has not expired must be returned to the resident or the resident's representative as appropriate, or may be centrally stored by the facility for future use by the resident at the resident's request. If centrally stored by the facility, the discontinued medication must be stored separately from medication in current use, and the area in which it is stored must be marked discontinued medication. Such medication may be reused if prescribed by the resident's healthcare provider. There's a possible 2 or 3 test questions from here. When a resident's stay in the facility has ended, the administrator must return all medications to the resident, the resident's family, or the resident's guardian, unless otherwise prohibited by law. If after notification and waiting at least 15 days, the resident's medications are still at the facility, the medications are considered abandoned and may be disposed. There's a possible 2 questions from here. Medications that have been abandoned or have expired must be disposed of within 30 days of being determined abandoned or expired, and the disposal must be documented in the resident's record. The medication may be taken to a pharmacist for disposal or may be destroyed by the administrator or designee with 1 witness. There's about 3 questions right there. Facilities that hold a special ALF permit issued by the Board of Pharmacy may return dispensed medicinal drugs to the dispensing pharmacy. That is a test question. Medication labeling and orders. The facility may not store prescription drugs for self-administration, assistance with self-administration, or administration unless they are properly labeled and dispensed in. If a customized patient medication package is prepared for a resident and separated into individual medicinal drug containers, then the following information must be recorded on each individual container.
The resident's name, the identification of each medicinal drug in the container, except with respect the use of pill organizers. No individual other than a pharmacist may transfer medications from one storage container to another. If the directions for use are as needed or as directed, the healthcare provider must be contacted and requested to provide revised instructions. For an as-needed prescription, the circumstances under which it will be appropriate for the resident to request the medication and any limitations must be specified. For example, as needed for pain, not to exceed 4 tablets per day. The revised instructions, including the date they were obtained from the healthcare provider and the signature of the staff who obtained them, must be noted in the medication record, or a revised label must be obtained from the pharmacist. PRN. The initials stand for pro renata, a Latin phrase that translates to as needed or as the situation arises. Any change in directions for use of medication that the facility is administering or providing assistance with self-administration must be accompanied by written, faxes, or electronic copy of medication order issued and signed by the resident healthcare provider. The new directions must promptly be recorded in the resident's medication observation record. The facility may then obtain a revised label from the pharmacist or place an alert label on the medication container that directs staff to examine the revised directions for use in the medication observation record. A nurse may take a medication order by telephone. Such order must be promptly documented in the resident's medication observation record. The facility must obtain a written medication order from the health care provider within 10 working days. A faxed or electronic copy of a signed order is acceptable. The facility must make every reasonable effort to ensure that prescriptions for residents who receive assistance with self-administration of medication or medication administration are filled or refilled in a timely manner. Sample of complementary prescription drugs that are dispensed by a healthcare provider must be kept in the original manufacturer's packaging, which must include the practitioner's name, the resident's name for whom they were dispensed, and the date they were dispensed. If the sample of complementary prescription drugs are not dispensed in the manufacturer's labeling package, they must be kept in a container that bears a label containing the following: practitioner's name, resident's name, the date dispensed, name and strength of the drug, directions for use, and expiration date. The term over-the-counter includes, but is not limited to, over-the-counter medications, vitamins, nutritional supplements, and nutraceuticals, hereafter referred to as OTC products that can be sold without a prescription. A facility may keep a stock supply of OTC products for multiple residents. When providing any OTC products that is kept by the facility as stock supply to a resident, the staff member providing the medication must record the name and amount of the OTC product provided in the resident's medication observation record. All OTC products kept as a stock supply must be stored in a locked container or secure room in a central location within the facility, and must be labeled with the medication's name, the date of the purchase, and with the notice that the medication is part of the facility's stock supply. OTC products, including those prescribed by a healthcare provider, but excluding those kept as stock supply by the facility, must be labeled with the resident's name and the manufacturer's label with the directions for use or the healthcare provider's directions for use. No other labeling requirements are required. Residents or their representatives may purchase OTC products from an establishment of their choice. A healthcare provider's order is required when a nurse provides assistance with self-administration or administration of OTC products. A healthcare provider's order for OTC products is not required when a resident self-administers his or her medications, or when unlicensed staff provides assistance with self-administration of medication.
Pharmacy and dietary. Uncorrected deficiencies. Any assisted living facility in which the agency has documented a Class 1 or Class 2 deficiency or uncorrected Class 3 deficiencies regarding medicinal drugs or over-the-counter preparations, including their storage, use, delivery, or administration, or dietary services, or both, during a biennial survey or a monitoring visit or an investigation in response to a complaint, shall be required to employ the consultant services of a licensed pharmacist, a licensed registered nurse, or a registered or licensed dietitian as applicable. The consultant shall, at a minimum, provide on-site quarterly consultation until the inspection team from the agency determines that such consultation services are no longer required. A corrective action plan for deficiencies related to assistance with the self-administration of medication or the administration of medication must be developed and implemented by the facility within 48 hours after notification of such deficiency, or sooner if the deficiency is determined by the agency to be life-threatening. Employment of a consultant. Medication deficiencies. If a Class 1, Class 2, or uncorrected Class 3 deficiency directly relating to facility medication is documented by the agency pursuant to an inspection of the facility, the agency must notify the facility in writing that the facility must employ or contract the services of a pharmacist or registered nurse as determined by the agency. After developing and implementing a corrective action plan, the initial on-site consultant visit must take place within 7 working days of the notice of the Class 1 or 2 deficiency and within 14 days of the notice of an uncorrected Class 3 deficiency. The facility must have available for review by the agency a copy of the license of the consultant pharmacist or registered nurse and the consultant's signed and dated review of the corrective action plan no later than 10 working days after to the initial on-site consultant visit. The facility must provide the agency with, at a minimum, quarterly on-site corrective action plan updates until the agency determines after written notification by the consultant and facility administrator that deficiencies are corrected and staff has been trained to ensure that proper medication standards are followed and that such consultant services are no longer required. The agency must provide the facility with written notification of such determination.